Muscle pain relief. Let's talk about it. Muscle aches are a common symptom of many conditions. The flu is one of the most well-known conditions that can cause muscle aches. Aches can also be caused by your everyday life, especially if you stand, walk, or exercise for long periods of time. You may just need to rest and some treatment at home to relieve your body aches. But some aches, especially those that last a long time, may mean that you have an underlying condition. In these cases, you may need to go see your doctor for a diagnosis. They can create a long-term treatment plan to relieve your aches and other associated symptoms. The most common cause of muscle aches are overusing the muscle during physical activity, fever, your hormone levels, stress and lack of sleep, muscle weakness, medication side effects, fibromyalgia. Symptoms: depression, dizziness, diarrhea, stiffness and weakness in the affected area, flu-like symptoms like fever, chills, sore throat, fatigue, headache, and cough, an inability to concentrate, signs of infection such as redness and swelling, loss of appetite, muscle cramps or contractions, numbness, tingling or burning sensation called paresthesias, problems walking, sleep disturbances, swelling at the site of injury, unexpected weight loss, and vomiting. Ways to relieve muscle pain naturally. Rest gives the body time to repair and recover. Drink plenty of water. Staying hydrated can help relieve muscle aches caused by dehydration. Soak in a warm bath with Epsom salts or take a warm shower. Temperature regulation. This can include reducing fever, staying warm, or staying cool to ease chills and prevent muscles from seizing up. Ice. Use an ice pack or a bag of frozen peas to help relieve pain and reduce swelling. Apply ice to the area for 15 to 20 minutes 3 times a day. Mustard oil massage. Massaging your body with hot mustard oil can help relieve pain. Studies have shown that the allyl isothiocyanate compound present in mustard oil helps reduce inflammation in the body. Drinking ginger tea. Scientists have compared the action of ginger to ibuprofen. Ginger helps reduce pain and inflammation in the body. Compression. Use a compression bandage to help reduce swelling. Drink turmeric and honey milk. The curcumin found in turmeric has anti-inflammatory, analgesic, and wound-healing properties that help relieve pain in the body. Drinking cherry juice. People with peripheral neuropathy often experience pain in their hands and feet. Studies have shown that cherry juice contains anthocyanin pigments which help treat pain in the hands and feet. Medications. Acetaminophen like Tylenol or a non-steroidal anti-inflammatory drug NSAID like aspirin, ibuprofen, Advil, Motrin, or naproxen Aleve can help to ease the discomfort. Just be cautious about using NSAIDs regularly. Muscle pain relief cream. What is it and how does it work? Pain relief products use different active ingredients to block or reduce pain signals. They come in cream, rub, and spray form. While formulation for each product varies, most topicals can be placed into 5 main categories. Counter-irritants. Called such because they cause a burning or cooling sensation that can distract you from your pain. Active ingredients include menthol, eucalyptus oil, oil of evergreen, and camphor. Effects are immediate but may not last too long. Menthol and methyl salicylate are known as counter-irritants. They work by causing the skin to feel cool and then warm. These feelings on the skin distract you from feeling the aches or pains deeper in your muscles, joints, and tendons. Some products should not be used on children younger than 12 years without a doctor's advice. Check the label carefully before using it on children between 2 to 12 years old. Do not use on children younger than 2 years old. Here are the best muscle rubs. Penetrex Therapy Cream, Voltaren Arthritis Pain Gel, Biofreeze Pain Relief Gel, Noxicare Natural Pain Relief Cream, Sombra Warm Therapy Pain Relieving Gel, Tiger Balm Ultra Strength Ointment, Floyd's of Leadville CBD Recovery Balm. What food can cause muscle ache? White bread, coffee creamer, alcohol, salt, sugar, gluten, saturated fats. Best food for muscle pain relief. Fish. Fish like cod contain plenty of healthy fats and is rich in omega-3 acids, which is great for fighting inflammation. If you're suffering from arthritis, then you might want to implement fish into your weekly diet, as its effects have been proven to reduce pain in joints. Cottage cheese. Dr. Carolyn Sederquist, founder of Bistro MD, recommends eating cottage cheese or Greek yogurt post-workout or when your muscles are tending up. That's because both are good sources of protein. 1 cup of cottage cheese offers 14 grams of protein, while Greek yogurt provides 11 grams per serving, and protein is essential for muscle recovery. The general population needs an average of 0.8 grams of protein per kilogram of body weight, Dr. Sederquist says. As the workout intensity and duration increases, so will protein needs. In addition to cottage cheese and Greek yogurt, Dr. Sederquist recommends shell edamame, chickpeas, or nut butter. Leafy greens. We all know that spinach, bok choy, kale, and Brussels sprouts are great for our overall health. But more importantly, they also have a great effect on those who experience sore muscles and joints. Eggs. Cassie Vavrick, registered dietitian at OSU Wexner Medical Center, says eggs are a great post-workout food. Not only are they a good source of protein, but they also contain taurine. Research suggests that this amino acid may help speed recovery, especially when it comes to higher intensity training. Taurine is also found in certain meats and fish and is sometimes added to energy drinks. Cherries, blackberries, blueberries, raspberries, cranberries, and strawberries all contain anthocyanins. Coffee. Go ahead, grab that coffee or tea after your sweat session. Research indicates that caffeine intake after exercising can help improve muscle repair and fight muscle soreness, says Vavrick, but she warns against overdoing it. To reap the benefits, use your weight and body size to determine a good amount. For instance, a 135-pound woman would find relief by consuming around 350 milligrams or about 2.5 to 3 cups of coffee. And feel free to add some milk to that coffee. It's packed with vitamin D, calcium, and potassium to build bone mineral density and speed recovery, says registered dietitian Elizabeth Ann Shaw. Bananas. Speaking of potassium, you may be able to avoid the soreness altogether by eating a banana before working out, says registered dietitian Natalie Rizzo. Rather than easing muscle soreness, bananas prevent muscle cramps during a workout, she says. Most Americans don't get the recommended 3,500 milligrams of potassium per day, so it's essential to include potassium-rich foods like banana in the diet, she adds. Other great sources of potassium include coconut water, sweet potatoes, white beans, winter squash, chicken, and pistachios. Can cancer affect your muscles? In leukemia and myelodysplastic syndromes, or MDS, the bone marrow, the inner spongy part of the large bones, can become filled with cancer cells which can cause bone or joint pain. In myeloma, masses of cancer cells can form in the bone marrow, causing bone pain in the arms, legs, back, or chest. Anemia muscle cramps. Dr. Query noted that the major symptoms of anemia include fatigue, muscle cramps, dizziness, and becoming winded with exertion like climbing a flight of stairs. An odder symptom is the desire to chew on ice. The symptoms may be easy to dismiss at first, but as anemia intensifies, they really affect daily living, says Dr. Query. How does MS or multiple sclerosis affect your muscles? The two types of pain people with MS experience are nerve pain and musculoskeletal pain. Both types indirectly contribute to aching joints and body pains. While MS doesn't directly affect the joints, it does affect other areas that lead to joint and body pain. For example, a loss of energy leads to physical deconditioning, resulting in weakened and vulnerable muscles. A loss of balance and stiff limbs results in an uneven gait that affects the joints. A weak posture results in painful pressure in the lower back. Frequent muscle spasms affect mobility and general flexibility that support the joints. Yoga and muscle pain. Physically, yoga helps to strengthen the muscles that have been weakened from a lack of movement, and the stretching in yoga helps with muscular tightness. It also helps with discomfort from lying in bed or discomfort from a procedure. Can anxiety and stress cause muscle pain? Muscle aches and joint pain can be caused by tension as well as general poor health. Anxiety causes the muscles to tense up, which can lead to pain and stiffness in almost any part of the body. Constant stress and worry can also prevent the immune system from working properly, leading to decreased resistance to infection and disease. Infection increases inflammation in the body, which can cause a range of symptoms, including joint pain. When should I be worried about muscle pain? Myalgia can also be a sign that something is seriously wrong in your body. You should see a doctor for pain that doesn't go away after a few days of home treatment, and severe muscle pain that arises without a clear cause. Muscle pain and COVID-19. The U.S. Centers for Disease Control and Prevention recently added 6 new COVID-19 symptoms to its official list. Now, in addition to the standard dry cough, shortness of breath, and fever, the CDC also lists chills, repeated shaking with chills, headache, sore throat, new loss of smell or taste, and muscle pain to the list of signs of a coronavirus infection. To be clear, many of these symptoms aren't brand new discoveries. In March, ear, nose, and throat specialists in the United Kingdom warned that loss of sense of smell or taste may be a symptom of COVID-19, and anecdotally, people have also reported chills, headaches, and sore throat. The newly added symptom of muscle pain, however, may be a little bit more surprising than the rest. While body aches and pain can be the result of pretty much anything, it turns out coronavirus-related muscle pain is a bit different. Why aging brings aches and pains. The increased complaints of a musculoskeletal pain with aging appear the results of a complex interaction between the physiologic process of aging, which seems to promote muscle damage and muscle hypersensitivity, especially in the male sex, and also the increased prevalence with age of most potentially painful pathologic conditions of the muscle itself or of other deep somatic structures. Future clinical and research efforts should aim at better understanding the pathophysiology of the increased pain in muscles in the elderly to help prevent not only the suffering of the patient, but also the disabling consequences of the pain symptom at this level. How long does it take to recover from muscle pain? Recovery time depends on the severity of the injury. For a mild strain, you may be able to return to normal activities within 3 to 6 weeks of basic home care. For more severe strains, recovery can take several months. In severe cases, surgical repair and physical therapy might be necessary. Without proper treatment, most people recover completely. You can improve your chances of recovery by taking steps to avoid getting the same injury again. Follow your doctor's instructions and don't engage in strenuous physical activity until your muscles have healed. What can you give a child for muscle pain? Have your child rest the area that hurts. Your child may need to stop or reduce the activity that causes symptoms and then return to it slowly. Put ice or a cold pack on the area for 10 to 20 minutes at a time to ease pain. Put a thin cloth between the ice and your child's skin. Be safe with medicines. Read and follow instructions on the label. If the doctor gave your child a prescription medicine for pain, give it as prescribed. If your child is not taking a prescription pain medicine, ask your doctor if your child can take one over the counter. Rheumatism and muscle pain. People with a rheumatic condition may experience joint pain, muscle pain, or both. Pain is caused by inflammation and is experienced to varying degrees. It may be accompanied by stiffness of a joint or limitation of movement of a painful body part. Joints affected can range from the smallest in the foot to the larger joints in the hip and knee, or spinal pain giving rise to neck pain or back pain. If you have any experience with muscle pain, please share it with us in the comment section.